Hi, everyone. I'm Vitor Domingos, Hitachi Digital Services Lead Solution Architect and Evangelist in EMEA, and I'll be your moderator for this webinar today. And it's going to be about how AI opens a new era of efficiency in healthcare. And it's all about the AI-fueled productivity that I think everyone is looking for. Today's panel is quite exciting for me, and I'm really looking forward for our conversation today, not only to hear from them, but also from our audience. So I think that on your screens, you have a Q&A box where you can put your questions and we'll bring them forward to the panel. We have a planned Q&A at the end, but I want to make sure that this is more interactive and interesting for everyone. Because for me, as I mentioned, as a technologist and also an evangelist in Gen AI, I'm really interested to know the panel opinion about how AI and Gen AI can solve some critical pain points in healthcare, but also what are the real world application benefits and challenges of using this technology, Gen AI and AI in healthcare workflows, but also bring all of the, let's say, ethical and responsible considerations where we should have when implementing this technology, how we need to address patient data privacy concerns, and overall the future of Gen AI-driven healthcare, where we think we can drive the journey forward for everyone's benefit. Gen AI and AI in particular is quite exciting because of its capacity to create for creative problem solving, let's say. From your perspective, what are the kind of novel ways or innovation in which Gen AI and AI is helping healthcare professionals?
Let me start off by sort of level setting the challenges in the marketplace that are more contemporary. Generally speaking, supply-demand configuration is changing quite rapidly. Medical graduation for clinicians is reducing, number of residencies are reducing, people are getting older and sicker faster, the prevalence of disease is increasing, and the way healthcare is being funded is also changing, where there's more government and employer coverage compared to commercial coverage. And what that is driving is a level of financial pressure on health systems and health plans, driving a lot of vertical integration. In the US, we did a study where we surveyed about 355 health insurance companies and health systems, and almost 50% of health plans had indulged in some form of vertical integration being acquiring a non-similar business. Almost 50% of health plans or health insurance companies had indulged in some form of vertical integration, and 34% of health systems had indulged in vertical integration over the last 3 years. And so what that is doing is it is transforming and creating a new value chain, right? It is transforming the legacy value chain into something new, and that continues to evolve. So really where I think there's an opportunity for the canon of AI, including Gen AI, is to further lean into the quadruple aim of care, which is to reduce the cost of care, which is to enhance the experience of care, which is to improve the health outcomes and address health equities. So at this early, and I'll still say it's fairly nascent in so many ways, Gen AI is generally being used on the admin side of things, right, to essentially improve productivity and efficiency, whether it be addressing claims, whether it is to do customer service, whether to assist with prior authorizations here in the US. But we're also beginning to see Gen AI being used in the exam room for diagnostic help, in order to transcribe and do an additional listening for clinicians. So I think it's still fairly new. In that sense, there is a level of risk mitigation that is in the clinician's mind. They want to certainly use Gen AI, but they're not entirely sure where it is appropriate and not. So I think over the next couple of years, we'll see the adoption of Gen AI to do member management, to do patient engagement, and to improve the diagnostics as we go forward.
Can you kind of briefly describe how your organization is currently using AI, Gen AI, to drive this innovation in healthcare?
So I am the co-founder and CEO of a company called Luminai. And what Luminai does very simply is we essentially help large healthcare organizations move their repetitive, mundane, very complex, long-range processes from people to computers. And the way we essentially do that is by ingesting how the process documentation of certain processes are done and creating basically automations that go out and execute that. And so we're essentially taking these like very standard operations and procedure documents, ingesting them in the context of the work that needs to be done, and then creating basically an automation program that goes out and executes that. And our view is primarily that, like in healthcare especially, the most critical aspect that's necessary that isn't necessarily as relevant in other industries is the tolerance for errors and tolerance for mistakes. There's zero tolerance for errors in these processes that exists within healthcare. And so you need to be able to have a level of reliability and robustness within these processes to do them effectively, and for organizational leaders to pick solutions effectively. And at the fundamental level, AI is a probabilistic technology. And so it is going to make mistakes in aspects of this. And so that's really what Luminai is focused on, is basically making sure that generative AI is able to automate these processes without those mistakes. And so we're mostly spending our time in building the verification and workflow engines to be able to solve for that. And so if the through line really is that like mistakes aren't tolerated in the healthcare space, and it's deeply critical that we keep it that way, because the amount of impact that it could have on the organization, on the patient lives, becomes deeply important as a consideration as we make this sort of transitional shift.
And this will sound quite biased, but Paul, in your view on how Hitachi Digital Services is currently using AI to drive innovation in healthcare.
Yeah, so I mean, I think I pick up on Rohan's point initially, which is the great opportunity we have around productivity and efficiency. You know, whether that's looking at the workforce constraints that we have today, or just the general level of time it takes to manually move data and execute processes across healthcare systems, where you have lots of disconnected platforms and you have lots of manual intervention, whether that's phone calls, emails, etc., spreadsheets that are essentially the backbone of how people are moving and flowing through that system. So a lot of what we did originally was look at how we can use more traditional forms of AI and machine learning to really consume real-time data from the system and provide insights to staff in real time to aid their decision making. So really thinking about that short-term planning, and actually, you know, someone turns up in the emergency department, you know, do we know their likelihood of propensity to be admitted? Where would they go to? How long are they going to stay? What impact's that going to have on the hospital system? And so really trying to turn all that data into real-time nudges, if you want to call it that enable people to move faster through the system. The second way was when thinking about how you connect different stakeholders within the system. So thinking about how we move care and systems from being more reactive to more proactive. So giving them insights into the future. Where are the bottlenecks going to be? Where are the resources going to be short? What can we do to resolve those things before they actually occur, so we can actually allow people to flow through that system faster? You know, additionally to that, I think, you know, we have been working in areas of more clinical sort of AI and machine learning, especially with our colleagues in R&D, more around clinical decision support and things like, you know, sort of stage 4 solid state tumor decision making around, you know, when's it appropriate to introduce things like supportive therapies into the care process, when is ongoing medication going to have a diminishing, you know, effect on a patient and impact their quality of life. But I think to Rohan's point, those things take a long time because of the ethics and the trust and the evidence that's needed to introduce those forms of AI into the clinical decision-making process. So those are really the areas that we're working in. I think, The primary focus for now is actually around some of the technologies that Cassava talked about, which is, actually moving from that. Now we have decisions. How do we turn that into action? And then how do we make those actions happen more efficiently for all the stakeholders in the care chain? So actually we're moving away from just that sort of draw on AI to give us intelligence, but then thinking about how does it actually affect action as efficiently as possible.
And Rowan, kind of coming back to you, because you're more focused on, I believe, in the part of the research and bringing all of that data forward, make sure that we are aligned in terms of the same goals, or you see at least the same future. Because I'm just trying to understand we heard from Paul and Kashav that there are some issues here. We need to bring a lot of considerations into the table, but also how we're going to put all of this new technology, because we've been hearing about AI, machine learning, and now Gen AI. What is for you, or how do you feel the vision to implement this technology into the healthcare world to drive all of these issues and problems forward and address them?
I look at it across the spectrum. On one end of the spectrum is reimagining and transforming the value chain and the processes, whether it's in a hospital, whether it's with a health insurance company. There's an opportunity to reimagine a lot of these processes, because a number of these processes are from the last century, when the problems to be solved were very different, right? Here in the 21st century, we are consumed by climate change, for instance, an older population, higher prevalence of disease, pandemics, and so on. So there's an opportunity to transform and reimagine what those processes and value chain attributes should be. On the other hand, the creation of new technologies far exceeds the ability to reimagine those processes. So what has been happening is that there is a greater propensity for technologists and healthcare leaders to leverage modern technologies, Gen AI included, to solve for legacy problems. And those legacy problems, in some ways, I think is a little bit of a missed opportunity, because in my opinion, I think we ought to be using new technology to reframe and reimagine what we need to be solving for in the future. So right now, as I was indicating, Gen AI is being used to address and help and improve the efficiencies of addressing administrative aspects, right? Whether here in the US, whether it is prior authorizations, whether it's claims, whether it is improving the quality of the usage of data in an electronic health record system, right? Or it is being used to augment the ability of a clinician to do their listening, right? Typically when a doctor is in an exam room, they're able to only do so much of listening. But with Gen AI in the room, and we see this with a nuanced kind of an application sitting in there, they're able to sort of augment their own listening and their own ability to, with diagnostics, to further expand that as a force multiplier. So that's kind of how I'm beginning to see this evolve over a period of time.
And picking up on what you said regarding reducing the burden of the admin process or the workflows, and now going to Kashav, we know that Luminai, as mentioned, is a company focusing on AI to optimize these kind of workflows. But how do you see this kind of new technology, AI and Gen AI, to reduce this burden, this administrative burden on the healthcare providers, particularly, for example, in doctors and nurses?
If you think about like the job of a provider, right, or the job of a doctor, and you ask them like on day one, like, what did you sign up for? Like majority of them would probably say, or almost all of them, if not all of them, will say, I signed up to give the best care I give to patients. But in reality, like today, like I think 60 or 70% of their job is like clicking and typing, and the sort of mundane work that like us as humans should not be doing, let alone probably the most prized profession and prized sort of people who save lives, like doing God's work in some ways. Like, they should not be doing that. And when you go and ask them, hey, like, what do you think about the sort of clicking and typing that you have to do while you give care? It's almost like a lot of them say, hey, this is the pain I need to go through so I can go and do the work that I care about. And that's like the worst position you put someone who is doing such critical work in this world. And so very simply, like the more and more you remove that type of work from their day to day, the better care that they're able to give, the better like sort of the happier they are, therefore the better care they end up still giving. And then the third is like you end up getting a much larger sort of output just in terms of the final sort of work that clinicians and providers end up giving within a healthcare system, within an organization that provides specialty care. And so that's really what sort of Luminai's vision mission is, and hopefully all of ours in some ways is like, how do we increase the total amount of hours spent on just care and reduce the amount of just mundane work that's being done. And that's hopefully what generative AI and AI in general is trying to solve for.
Rowan also mentioned that kind of AI and Gen AI could augment, and we've been talking about that, how augment all of these professionals in healthcare. But for Hitachi, how do you see this AI technologies enhance all of this decision-making process for professionals? Is it just for the admin part of it, or is it more kind of in a broader context?
No, and I think sort of picking up on both what Rohan and Kessler have said, I think it's not just one technology, right? It's the intersection of technologies that's important. So if I think about the example that I think Rohan mentioned around the ability for AI to script clinical conversations, we can think about that maybe in some kind of MDT session, whether that's happening virtually or physically, using the AI to more accurately, actually, and in real time translate those conversations, understand what's happening clinically, notate what's going on in the care. But at the same time, if we're then able to like pick up on the actions within those conversations as well, so we need to make an emergency theatre session available, we need to book, pharmacotherapy, we need to book X, Y, Z, and then allocate those procedures down to essentially worker bots that Kessler has mentioned, which can then go and perform those actions in the background. There are two benefits there, and I think this was articulated early. One is the administrative burden is getting reduced, so the professionals are having all of their time now focused right in front of the patient. They're not having to, turn their back, go off to the computer, wait for someone else to raise an order in a system. All of that is happening much more in real time, and that's affecting the care journey for the patient. So that has a direct clinical benefit, and it has a benefit for the clinicians themselves. So I think it's really around how do we find that sweet spot in sort of bringing these technologies together, where we're actually unlocking productivity and efficiency, and we're also then using the AI to enhance the quality of, let's say, note-taking, timeliness of decision-making, timeliness of handing to the next stage in the process. So for the patient, that journey is more seamless, and it's being executed with sort of a level of rigor and speed, which means that they get the best possible outcome.
I think we have Amit that is asking about he says that dealing with a patient is one aspect, dealing with care, with their care pathway is a separate and often done during the keyboard time. He asks kind of how will we replace that with a clinical pause, checking all guidelines-based care is provided in the right order. So I'm guess that we all have a procedure that you need to go with, and you need to understand how is this going to be in terms of practical kind of use case, how is this going to impact the all of this uncertainty with still document for the next kind of clinic or ward visit. How is this gonna be impact? I'm not sure if you want to pick that one, Paul, since we finished with you.
In my mind, we're not seeking for Gen AI to replace the clinical judgment of professionals, right? So this is about enhancing the work they do and supporting their standard work, right? So if we are thinking around the clinical pathway for a particular individual, for a patient. Actually, the best point of judgment on that clinical pathway is always going to be the clinician. Actually, maybe providing, let's say, insights on the patient condition based from previous medical history and surfacing up to the clinician at the point of care, things which they might have to take, several minutes to read through clinical notes and history. But actually maybe using something like explainable AI to bring out those factors so that actually we can present that to the clinician. Might be a number of, let's say, maybe on discharge, actually, what's the likelihood of readmission of that patient? What are the signs potentially in the patient context that might give a clinician, reason to make a judgment on whether an additional care package is needed at the point of discharge? So I think that's where AI can help. It's obviously going to reference, clinical literature and evidence, but it's really around the speed at which it can do that and then help that clinician in that decision-making process.
Our philosophy is very simple, which is like what we care about deeply is the productivity increase and the efficiency increase, as long as it is done in a like deeply reliable and robust manner. And so we'd rather be at like, we'd rather increase sort of productivity at the rate of 80%, not at 85. If we're going to make like 4 mistakes in that process, right? And so that's really what we're sort of going for. And so when it does end up seeing cases where it is complex or it's not something that is accounted for in that initial process documentation, Luminai is basically built out, and hopefully, more enterprise AI tooling has generally built out sort of the error handling as well as sort of the exception handling systems to make sure that like in the cases where there are essentially essentially there's like it's something that's new that the AI is now seeing, it's able to essentially then like route it differently and give it back to the clinician or to the provider or the admin staff on what that process ends up looking like for them to essentially pursue and do, versus anything that is sort of regular and anything that's seen. It's almost like in a way that's it's ideally super seamless.
So in that kind of a context, I would always argue that as consumers, we might certainly get a second opinion or a third opinion. At the end of the day, you the consumer will have to make a choice in terms of which clinician you have the most faith, and then you follow their advice, right? This is very tricky because multiple clinicians will have multiple suggestions, potentially multiple different diagnostics. Some of it enabled by technology, some of it just based on their experience and their instinct. And I think as a consumer, again, I sort of reflect upon the decision-making process that I would go through. I'd potentially it'll potentially end up with me deferring to the advice from the clinician that I trust the most.
The problem that has existed so far is this idea that we can throw technology at a problem and people will change, which invariably produces the wrong result. So a lot of our work has always been focused around actually thinking around, well, actually, let's think more about the problem from the end user's perspective and around the challenges with adoption, both at an individual or an organizational level. And then let's find a way to let the technology help with that. I think AI is no different.
Oh, thank you. I'm going to pick up from another complex question that we have from our audience. And this one is more in particular in terms of the ambulance service, because they capture a lot of data covering several years, including the condition of the patient and accurate location with reference of the emergency. And the question is how AI can predictively locate the ambulance by the hour and probably kind of put the map together, and it comes to a point that can help actually the professionals to plan better or manage better their systems, which comes back to another question that I have, which is we're talking about technology that sometimes is very disruptive up until a point that a lot of people are raising concerns that this might displace or might reduce kind of the workforce because we're doing a lot more with AI and Gen AI.
So I think my view is very much it's about augmentation and enhancing the role of healthcare professionals, Vitor. I had a conversation with a CFO of a hospital in the NHS probably about 6 years ago now, and we were talking about the efficiency gains that could potentially come through AI and machine learning and sort of advanced decision making. There was no consideration for reduction in staff in those conversations. In fact, the only thing that we could identify is that it would reduce the amount of goodwill those staff were providing. Many healthcare professionals are working beyond their standard hours or excessive hours just to keep up with demand. Right? So I think, if we can reduce the time that taken by healthcare professionals to deal with this sort of administrative burden and really just make their jobs more efficient, actually what that does is it increases the effective capacity of that workforce. It doesn't reduce the volume of that workforce. Does that make sense? So actually what we're doing is giving time back, and we're allowing that workforce to see more people, more patients, and spend more time with their patients. I think that should be our number one objective. I think there are too many shortages in both clinical and administrative teams today. There's probably a lot of unnecessary work as well. So part of this is about how do you increase the value generated by each member of staff, actually by not doing the things they shouldn't be doing and focusing their time on high value activities. But you can look at many examples, whether it's poorer outcomes due to skills variation across geographical areas, shortage of different clinical skills, which tend to get concentrated around urban areas rather than rural areas. And you can think about how AI can play a role in solving some of those challenges. So actually augmenting, not just at an individual level, but at a societal level to try and bridge some of these gaps and solve some of these problems.
The canon of AI, and Gen AI in particular, can drive proactive interactions with health consumers to improve the level of connectivity. You think about it in today's context. You feel sick, you go see a doctor, the doctor prescribes whatever they diagnose, they prescribe, and then you're out of the office, that's it. There's really no connectivity because doctors and clinicians don't have time to follow up, right? So I think Gen AI will begin to bridge that. There will be a different level of post-clinical follow-ups. There'll be different kinds of engagement, whether they're reminders for, annual visits or medications or other forms of connectivity. I also believe, given the level of disease prevalence and the shortage in clinicians, that Gen AI could potentially become the first level of triage to help health consumers to even navigate the system, to help direct patients to the right type of care, right? Whether they ought to go see a chiropractor or go see an orthopedic. Do they need to go see primary care or do they need to go to urgent care? This level of triage and direction to the right sort of care will also be helpful. And then the last thing I will say is it'll possibly enhance the level of support to overcome administrative barriers, right? I mentioned prior author earlier, claims denial, optimizing benefits, all of these admin stuff could potentially be overcome through Gen AI, allowing clinicians more time to actually do what they're trained for, which is to care for patients.
Thank you. And for you, Paul, just to finish with the last 3 minutes, how do you see the Hitachi Digital Services role in this area for the next, let's say, 5 years?
Yeah, so Vitor, I think a little bit of combination of what my fellow speakers have talked about, right? I think there is going to be this shift towards more of a digital front door for healthcare. I actually saw a very interesting lecture from a guy at MIT probably about 8 years ago, and he presented a picture of his bathroom as the next sort of GP surgery, where he's looking in the mirror, it's detecting whether he's got a problem with his eye, it's analyzing hair follicles in the sink, and you can sort of, he was expecting that to happen in 5 years' time, so we're a little bit behind that. But I do think this ability for these technologies to sort of think around how we engage with healthcare, and actually our role is really about working with customers to co-create those new processes that Rohan talked about, actually not think about just fixing problems. So I think that's where a lot of organizations get stuck. but how do we actually reimagine the future and sort of move 2 or 3 steps ahead? And I think that's really where where we're going to be focused with our partners and our customers.
So I would like to thank our panel for being with us today, also for our audience participating on the questions. And thank you very much for participating. And I hope that you can see you on the next webinar. Thank you very much.